I think Annie had it right when she sang the song, "You're never fully dressed without a smile." When you think of that phrase, what comes to mind? The smile itself or the teeth behind the smile? I think pearly white teeth are great to look at, but if you don't have healthy teeth behind those bright white teeth, you're missing the mark of how important your teeth are as an accessory. I want to talk to you about how important it is to take care of your teeth. I want you to think of the many times you have visited the dentist. What question do they often ask you? You know the one question you hate to answer because how many times you know it's going to be the wrong answer? How often do you floss? I know I've been guilty of saying daily when I know I definitely don't do it daily. Today I'm going to talk to you about the importance of taking care of your teeth, how to have good oral hygiene, then complete my speech on what happens if you don't brush and floss your teeth daily. It is also very important to visit your dentist regularly. I hope by talking to you today I'll encourage you to keep up your healthy habits or change the bad oral habits that you currently have. Which of these categories do you fall in? Now let's talk about how to achieve a healthy smile in 4 easy tips. Brush your teeth 2 times a day. Morning and evening are best. Make sure it's a fluoride toothpaste, and make sure you replace your toothbrush every 3 or 4 months. Floss daily to remove the food particles that get caught in your teeth. Keep in mind there is 5 surfaces to your teeth, and by brushing your teeth you only reach 3 of them, so flossing gets rid of the stuff that's in between your teeth. Eat a balanced diet and avoid the in-between snacks. And then also, like I said before, schedule a regular dentist checkup for professional cleaning and oral exams. And this information I got from deltadental.com. Now let's explore what happens to your teeth if you don't take care of them. I'm not sure if any of you know what periodontal disease is, but that is also known as gum disease. It's developed by having bad oral hygiene. It's caused from inconsistent brushing and missing of flossing your teeth. It builds up the bacteria that turns into gingivitis. That's here, and that's the red stuff that happens around your gum line. And then it turns into plaque. That's just the stuff that you don't brush well enough to get off. And then it turns into calculus, which is the stuff that gets so adhered to your teeth that they actually need a machine to get it off of your teeth. And then the roots start to expose. When that happens, you're going to lose your teeth. So make sure you take care of that by flossing. Now healthy gums, they're pink. They have no bleeding when you brush or floss, and your breath is fresh. Now when you turn into the periodontal disease, you get the red gums. You get bad breath, and again, your teeth pull away, so then you would lose your teeth. Now tooth decay, that is something completely different. You think it's related to gum disease, but it's a completely different thing. Tooth decay starts also in phases as well. It's a bacteria that grows in your mouth, and it gets acids that eat away at your teeth. So it first starts off where you get a little pain in your tooth, and then gets down into the nerve pain, so it gets a little deeper in there, and then when it gets down to the bottom, it'll crack open, and again, you're going to lose your teeth. And that information is from WebMD.com. And I'm not sure if you know, but your mouth is the gateway to the rest of your body. So it's called the mouth-body connection. So people with gum disease are twice as likely to die from heart disease and 3 times as likely to die from a stroke. Now 85% of people who've had heart attacks have gum disease. And this is because, like I said, the bacteria in your mouth, it just gets into your bloodstream and it causes other things to fail. And then 93% of people with gum disease are also at risk for diabetes. And then also with gum disease, it increases pancreatic and kidney cancer by 63%. So like I said, with this being the gateway to the rest of your body, 90% of all medical diseases are caused from something that happens within your mouth. And just think of this, cavities are caused by germ that is spread from kissing and sharing food. So keep that in mind. I didn't know that when I was researching. So some of this information is from the AtkinsDentalMedicine.com, MayoClinic.com, and the research was from Harvard University. So let's talk about some of the healthy mouth tips you can do. When you're done eating something sugar or sweet, just make sure you brush your teeth if you can. If you're not accessible to being able to brush your teeth, chewing gum, sugarless chewing gum, gets saliva moving in there and clears out the bacteria, so that's something you can do if you're not always brushing your teeth. Chew crunchy foods like apples, carrots, and cucumbers, not chips and lemon heads. And then use a soft bristled toothbrush. Oftentimes people get the hard ones because they're thinking a hard one's going to help get more stuff off. What that happens to do is it takes your gum line and it recedes it more. So just a soft one. You just brush it for 2 minutes each time. And then make sure not to neglect cleaning your tongue. That is also part of your mouth. So you can use your toothbrush. You can also just get a tongue scraper from the actual dentist or from Walgreens or any of those places. Again, brush and floss daily. I think I've said that numerous times, and I'm a previous dental hygienist assistant, so it's something that I always used to say, but now I know why you really need to do it. When brushing your teeth, if your toothbrush isn't available, you can swish your mouth with mouthwash as well, in addition to gum. And then don't smoke. This is the worst thing you can do, not only for your health, but for your oral health. Nicotine causes blood vessels to constrict, which interferes with your gum's ability to fight infection. So I got that information also from webmd.com. I think it's safe to say that having good oral hygiene isn't just to keep your teeth squeaky clean. It is a must for your overall health. Our smile is an inexpensive way to change our looks. Let's try and keep a healthy smile by taking care of our teeth. Brush and floss daily. I think I've said that numerous times. Visit your dentist regularly and eat foods that are not high in sugar, and most importantly, do not smoke. I'm asking you to please take care of your teeth. They're the only ones you have. I don't want your teeth to be like the stars that only come out at night. I know I'm going to make a conscious effort to brush and floss more often. Are you?